65 years after the first transplant operation, 100,000 patients a year worldwide receive organs from someone else's body. It is life-saving surgery.
After the transplant, it was shock and awe for the fact that I had another person's heart beating in my body.
But not everyone is so lucky.
People are dying without getting organs. Maybe 25 or 30% of the patients will die before they get transplanted.
For every patient who receives a life-saving organ, there's a heartbreaking story that made it possible.
My son's heart never stopped beating. It's of great comfort to me. Great comfort. It means that my child is still alive, somewhere, in someone's body.
Talia Isaacs waited 4 months in intensive care for new lungs.
I asked Mummy if I'd live almost every day.
In my opinion, if she did not have transplantation, it was unlikely that she would survive.
These are the stories of those who have given their organs to save others, and those who have been offered a second chance of life. It was the happiest day of their lives. Talia Farber, 29 years old, married Jonathan Isaacs. Family and friends were there to witness the joyous event.
When me and Talia got married, she was a completely healthy person. I don't even remember her getting a cold or flu.
Little did any of them know what lay ahead.
About a year, shortly after our 1-year wedding anniversary, the whole drama began.
Talia became critically ill.
It takes a toll on both the marriage and on the individuals. We're both very young. We had to change our whole routine, our whole life.
Talia's condition baffled some of the finest medical minds in South Africa.
We had to spend time discussing doctors, what I can eat and what I can't eat, and what I should do and what I shouldn't do. And we had to spend a lot of time in hospital all of a sudden.
Within 3 years, Talia was in intensive care and close to death, awaiting a lung transplant that might save her life. On May the 31st, 1985, Talia was born to Alan and Denise Farber. She was the youngest of 6 children. But even before Talia was born, tragedy had struck the family.
I lost my first child in 1975, drowning.
Chad was just 15 months old when he died in an accident. His twin Jason survived. Denise's daughter Candice died 6 years later.
My daughter got heat stroke when she was 11 years old on her birthday.
Talia grew into a healthy, happy teenager, and aged 25, began dating Jonathan, her future husband. It was soon after a holiday to celebrate their first wedding anniversary that Talia fell mysteriously ill. Her first symptom was a sore throat that developed into blisters in her mouth.
And progressively it got worse. The blisters had moved from my mouth to my cheeks, and they started tearing open. It was so raw that I couldn't eat. I went to plenty doctors. I was on mouthwashes, I was on medicines, I was on antibiotics, and nothing worked.
Talia began experiencing an even more worrying symptom. She was struggling to breathe.
This is serious. I literally can't breathe and I can't eat and I actually think I'm dying.
6 weeks after her original symptoms, Talia was rushed to hospital.
She collapsed. They rushed her up to ICU. They ventilated her and said they weren't sure if she could make it. She was that critical. And they didn't know what was wrong with her. I screamed and I said, I can't lose another child.
Talia was taken to intensive care and put into an induced coma. She was diagnosed with pemphigus, an autoimmune disease that causes severe blistering. And her breathing difficulties were blamed on another autoimmune condition called myasthenia gravis that weakens the muscles of the diaphragm. But her symptoms continued to puzzle doctors.
On several investigations revealed difficulties making a diagnosis because on one occasion it was discovered that the lung functions were getting better and on another occasion it was dramatically worse.
Dr. Paul Williams was in charge of Talia's care when a few months later the next crisis in her illness occurred. Talia had returned for what should have been a routine scan of her lungs and chest.
You see the right lung and the left lung, and those look completely normal. 100% normal lungs, and big and healthy.
But the scan did reveal something alarming.
You get to the back by the spinal cord, and here we see this nasty tumor, which is right on the vertebral bodies of the vertebra.
The tumor was 10 centimeters long and related to a rare disorder of the lymph nodes called Castleman's disease.
I went into a flat panic after that. I just thought I'd recovered, and now in my mind, I've gone 100 steps back. This was very traumatic, this whole experience.
She actually got quite hysterical at that point.
The surgery to remove the tumor was complicated and dangerous.
It was no joke, this procedure. Because it's too close to the spinal cord, they can potentially make you a paraplegic.
The operation took 4 hours. The tumor was found to be benign. Talia began to recover once again. But several months later, her breathing problems returned.
We thought that was it, Talia's fixed. So subsequent to that, Talia did recover very well from that tumor removal. But with time, she reduced the lung functions, and we realized that there was much more to Talia than just this tumor in a body.
Despite seeing a number of lung specialists, doctors were no nearer discovering the root of Talia's problems. Some even suggested her breathing difficulties were psychological, caused by anxiety.
The psychiatrist basically told me that I have many problems, which I didn't believe. Went to a new psychiatrist who put me on mild anti-anxieties, but she did not believe that there was any psychological issues. This was definitely a breathing issue.
Repeatedly, Talia was told that she has a psychological disorder, and that's why she couldn't breathe. And that played on her mind. She was also then, at that stage, quite a newly married young lady. Her illness and the effect it was having on their marriage was significant.
I made a lot of mistakes in that whole time period. Right in the beginning, when she first started getting sick, doctors were pulling me into the office going, it's all in her head. And they felt that she was making up a lot of the stuff and it was mental issues. This was right in the beginning, and they convinced me. And I tended to believe the doctors over my wife.
At her wit's end, 18 months after her first symptoms, Talia went to see another neurologist in Johannesburg.
We decided to go and see Jody Pearl for another opinion. We didn't know where else to go at this point.
Dr. Jody Pearl had treated Talia's mother for years following a stroke.
She came in out of desperation, and I remember her walking in carrying her oxygen cylinder, and she was seriously ill. She'd been investigated by a number of these other specialists that her breathing problem was psychosomatic. By the time we admitted her at Sunninghill, her oxygenation was so poor, it was quite obvious on the investigations, the blood gases, that this was certainly not psychosomatic.
Jody Pearl also eventually felt completely helpless, and that's where she made a phone call to Professor Murr. And this was the turning point for my recovery.
I then called in a favour and asked Professor Mervyn Murr to please assist us with this difficult case. He then came on the weekend to see Talia, and this was a changing point in her life.
Professor Murr went to the Sunninghill Hospital. With his 35 years' experience in critical care and respiratory medicine, he examined Talia for the first time.
Following the interview and a thorough clinical evaluation, I had a far better idea in my mind as to what may be going on.
Professor Murr put together Talia's mouth ulcers, her tumour and her breathing problems, and came up with a new and original diagnosis.
There is a syndromic complex that is associated with an entity called bronchiolitis obliterans. And I was pretty certain right then that was what we were dealing with.
Bronchiolitis obliterans is a condition that blocks the smallest airways in the lungs. The syndrome identified by Professor Murr is extremely rare and potentially deadly.
In my opinion, if she did not have transplantation, it was unlikely that she would survive.
Now convinced he knew what was wrong with Talia, Professor Murr contacted Dr. Williams.
I took his call and he told me the whole story about Talia.
I said to Paul Williams, I know what's going on here. This young lady needed a lung transplant if we were going to salvage her. It's not really about making a fancy diagnosis. It was about saving someone's life and offering an opportunity to someone who definitely wanted to live.
I was finding it difficult to accept that her lung functions could have deteriorated so dramatically in the space of 6 months to the point of needing a lung transplant. I found that hard to believe.
Dr. Williams now needed to confirm the new diagnosis for himself.
Although I didn't disbelieve what he was saying about how sick she was, we needed to see for ourselves exactly what the position was. And the obvious thing to do was to transfer her to Mill Park Hospital so the entire team could see her and come to an independent evaluation.
Mill Park Hospital is a leading centre for transplant surgery. The number of operations has doubled in the last 10 years. Talia arrived here the next day, and Dr. Williams examined her again.
I was absolutely horrified by what I saw. She was extremely ill, and her situation had deteriorated beyond my wildest dreams from when I'd seen her. And it was quite clear that this was a progressive illness that wasn't going to get better.
The diagnosis stunned Talia and her family.
I was in shock and probably a lot of disbelief. But again, I was still quite delirious, so I couldn't quite focus my mind as to what was going on.
A lot of them gave me the impression that they weren't sure if she was going to make it. And they said that if she doesn't get lungs, then there really is no hope.
The chances of survival are minimal. The odds are against you.
While Talia lay desperately ill in hospital, doctors agreed there was no alternative to a lung transplant.
I think when she got to the point where that final penny dropped, she was way beyond the point of the question of does she need a transplant, she definitely needed a transplant. It was the only way that we would have salvaged this patient.
This was uncharted territory, but Talia was so desperately ill that we could not say no. We could not say we can't do this. We said, you know, if you're prepared to go for this, we'll be prepared to go for it. Occasionally do end up doing things that we know are a really long shot because it's the right thing to do. But in my heart of hearts, I wasn't absolutely convinced it was doable.
With the decision taken, Talia and her family now had the long and agonizing wait for suitable donor lungs to become available. South Africa has a distinguished place in the history of organ transplantation. 50 years ago, here in Cape Town, Dr. Christian Barnard performed the first heart transplant. It turned him into an international superstar. His operating theatre has been recreated at a local museum. The recipient, a 54-year-old man, survived just 18 days. But 4 years later, Barnard's last patient survived more than 23 years. Today, there are 4,300 patients in South Africa awaiting a transplant. The shortage of organs is acute, and the families of many donors must overcome cultural and religious objections. At the end of May 2018, 14-year-old Daniel suffered a sudden brain hemorrhage. He was rushed to hospital.
We were all in shock that first evening because we didn't expect something like that to happen to our family, and certainly not to Daniel.
For a week, Daniel lay in a coma, his mother by his side.
It was very strange. It's like I was holding his hand. I washed him. I said goodbye to him. I put lotion on him. I don't know why, but, you know, I did everything a mom had to do. When people ask me why I was, when people ask me how was I able to be strong, I said, it's my child. I'm his mom in life and in death. That doesn't change. The neurosurgeon was very careful, cautious, not to give us much hope that he would come out of the coma.
His mother was asked if she would consider donating Daniel's organs.
In our community, organ donation is not something that is very traditional. If somebody passes away, they have a funeral service, which is very traditional, and they bury the body, and that's normal, that's accepted. And I said, I don't care. I make my own decisions as far as my son is concerned.
With a long list of patients awaiting organs, other lives depended on Lineker's decision.
I already had made up my mind at that stage. I said, how many people how many lives can we touch? How many, you know? And she said to me, the potential is 7. So I said, okay, you can certainly harvest these organs if we could impact on 7 families. For me, it made perfect sense. I have a healthy son, healthy heart, healthy, liver and kidneys. Why should that go to waste when someone else could use it? It's young. His tissues are still young and viable and vibrant. And so we want to pass his life force on to someone else. It's one of the things that just keep me strong, is knowing that we lost our boy, but other people are thriving and are healthier because they received something from him. The fact that my son's heart never stopped beating is of great comfort to me. Great comfort. It means that my child is still alive, somewhere, in someone's body. And that's amazing. And that's his gift and that's his legacy. And I want to make sure that my son's legacy lives on, you know?
Hospitals in South Africa are sensitive to the sacrifices made by donor families. In some, there's a ceremony before donor organs are harvested called the donor pause. In others, doctors and nurses observe a minute's silence as a mark of respect.
Thank you.
We accept the gift of the donors with open hands because we have to have them. They donate because they are helping mankind or humanity. And that is the correct attitude to have. So, you know, we are fully aware that we are taking organs that the patient can't use and giving them to somebody who can use them. But be mindful that it's a terribly sad situation.
He was only 3.6 kilos at birth, and at 10 weeks he weighed 7.2 kilos. A real happy, healthy baby. You know, he was already pushing himself up at 10 weeks. I mean, he was just really obviously the love and joy of our life. First boy, first baby. And, you know, one never could think that it would end that way. And you know what, you lose the dreams. I mean, everyone's got dreams for their first child, for every child. But you know, you think what it's going to be like when he's growing older, and you know, and then it ends on 11 weeks. 17 years ago, 2001, and I was on maternity leave. And we went to Cape Town with my parents on the Monday afternoon. There was a drunk driver that hit our car from the front on the N2 highway on a blind height. My parents passed away on impact, and our baby boy, Yesia, at that stage 11 weeks old, was in a coma immediately. They told us that evening that they can pick up that there's bleeding somewhere, internal bleeding, but they couldn't tell us exactly where. And they told us that the next 48 hours will be critical. We went home about 12 o'clock that night, and 4 o'clock in the morning we got a phone call from the hospital saying that we need to come back because his heart has stopped. But they you know, it's beating again. So we went back there, and they told us 8:30 that morning that, yes, he was brain dead. They told us that we can go to him, pick him up, while they will switch off the machines. And while we were waiting for them to do that, we had a nurse coming in asking us if we would consider donating his organs. We didn't think about organ donation until that point. We were never faced with it before. We didn't know what it was about, really. We knew it exists, but you know, you don't think about something like that until you're really in that position where you need to make a decision. They asked for his corneas, his liver and his kidneys. We were very much uninformed, and we didn't want them to touch his eyes. So we didn't donate the corneas, but the liver and the kidney went to 2 different children. The morning of the funeral, so we had the funeral for my parents and for Yesia together. And while we were getting ready for the funeral, we got a phone call from the transplant people in Cape Town which informed us that the little boy that received the kidneys, he was 6 years old, sat up straight in his hospital bed that morning and he asked for ice cream for lunch. So it was also kind of, good with the sad to know at least he's doing well and it was successful. It's good for us to have closure on what happened because, if you lose a child at any age, but, 11 weeks of age is you kind of ask yourself, what's the purpose? Really, why 11 weeks? And in our case, knowing that he's touched so many people's lives in such a short time, we feel proud and we feel privileged of, being able to do something for someone else, even if the price is very high to pay. It's, that something good came out of it. What he lives on in our hearts, and we're 17 years down the line and people still talk about him. What if we said no and nothing good came out of it? What would have been the story? And therefore it's so important, I think, for, if I can say something to recipients, it's good for us to hear that it's going well. We don't need to know names, we don't need to know anything, but give us a story, to bring closure to our loss and our pain. We would like everyone to, we would like something good to come out of it.
That's something I've always felt extremely passionate about, is that the only legitimate people to plead for organs are patients who've got them already. And can say, this is how I've benefited. That is so inspirational. That if that doesn't make people want to donate organs, I don't know what does.
I'm Fawn Rogers. I had a double lung transplant 5 years ago.
My name is Hassan, his surname is Sheikh Ibrahim. I had a heart transplant in January 2009.
My name is Alice. I'm 34 years old as of 2 days ago, and I was born with cystic fibrosis, which is a genetic disease affecting mainly the lungs. And I've undergone 2 bilateral lung transplants, one at the age of 23 and then at the age of 33.
My name is Brian Lombard. I've had a double lung transplant in 2007. That is 11 and a half years ago. And can't say that it was not worth every minute that I went through.
And then when I got my transplant, it was I was also given this future that I never expected. So it was not only being grateful for today, but being grateful that I can plan for tomorrow.
I got to know the other 2 people that received the organs from the same organ donor that I did. One was a double lung transplant in the theater next to me, and the kidneys and liver went to a young boy at Donald Gordon Medical Institute. And we get to know each other, and surprisingly, when we meet each other, it's like we are sort of relators.
Very, very healthy lungs. I've got very young lungs. I know for a fact that it was a person from Port Elizabeth that was 20 years old. And I got the lungs, and South African Transplant Sports Association's chairman got the heart from the same donor. And we are like transplant brothers. So, to me, it is totally, totally life-changing.
It took me quite a while to obviously build up physical strength and emotional strength to sort of get back in the world and decide what I wanted to do with my fresh start. But eventually I worked it out, and now I'm living a life that any normal 31-year-old would, thanks to my donor.
You've always got this love relationship with the lungs and with the donor, even though you don't know exactly what they look like or anything like that, but it's almost just it's nice to think that maybe they're an angel looking down on you, or maybe even if they're not an angel, but that they are seeing you or something, that they can just realize that you appreciate it.
After the transplant, it was shock and awe for the fact that I had another person's heart beating in my body, and I'm ever grateful to that family. But at the same time, I started to breathe normally. I could feel I was getting better. You know, you had the side effects of the medication, but that was not overwhelming to the fact that you got a heart transplant and you can now live again.
Talia Isaacs lay in intensive care while the search for her new lungs went on. But the chances of finding new suitable lungs for her were not good. Her surgeon knew the dangers she faced.
People are dying without getting organs, and then the mortality on our waiting list is not insignificant. So maybe 25 or 30% of the patients will die before they get transplanted.
As the wait continued, Talia's condition deteriorated.
Twice, I felt like I was gonna stop breathing if nothing happened. And both times I did get ventilated in hospital because my breath got shorter and shorter, and I could feel, it almost feels like a panic attack coming on, but it's more than that. It's literally your lungs closing up on you.
Every occasion was a complete emergency that took us by surprise and came very, very close to death on all three occasions. And immediate action had to be taken to save her life. I did feel that our luck was running out.
With Talia's future uncertain, her family kept a constant vigil.
I was very, very lonely in the evenings and very scared in the evenings. That's the time when you think about what ifs and the fear of actually not being with your family. However, I never once believed I was going to die. I never thought about death. I just had a lot of guilt for what my family and the trauma they were all going through.
Every time she had a resus, it took her, there was another setback. So it's, you know, we didn't, you know, there were many times we never thought that Tali would make the night.
We soulmates. She's my best friend. And I think that it was a struggle. So to watch someone you love so much suffer is not a nice place to be.
Week after week went by, month after month went by, with this amazing young lady in ICU with great support around her, and we remained in contact, and I would often pop in late at night, and she would often message me late at night, 10 o'clock, 11 o'clock, 12 o'clock, and we kept on encouraging her and telling her, just hang in. Those lungs are going to happen.
I think it was just her resilience and her inner strength blew us all away in the end. You know, I don't think I've seen anybody with that amount of inner strength and resilience before. She fought hard.
I was definitely getting weaker, but I never let myself believe that. I was always strong. I never gave up. I never believed that I was too weak to carry on.
For 3 months, none of the lungs that became available for transplant were acceptable for Talia.
You have to wait for perfect lungs. And they have to be the right blood group, and they have to be the same body surface area as Talia. So the length or height of the patient, and the body weight, and the chest circumference is what you look for. You can't put huge lungs into a small little body, and the other way around.
By Christmas, it seemed Talia might only have days to live.
We had to be realistic with her husband and explain to him that despite the enthusiasm from the family and the encouragement that we had, we had to have a very, very realistic view of the situation. So without trying to break his spirit or destroy his optimism, we had to explain to him very clearly that we did not necessarily foresee a good outcome, and in fact, a very bad outcome. In fact, Talia's death was a far more likely outcome.
Basically, her only chance is to get new lungs. She needs them within the next week. Chances of getting lungs in the next week is extremely low.
I asked Mommy if I'd live almost every day. I asked her with conviction each time, am I going to live?
She had panic attacks. She was ventilated 3 times. She actually couldn't breathe. She was on her last legs.
I was worried about the last week. She got completely chair-bound and bed-bound in the last few days, and we said to each other, if Talia doesn't get organs within a week, we're in big trouble.
I was getting extremely depressed at that point and felt this was the end. And as a husband, it was all going to be on me, and I would have to do things like funeral arrangements and figuring out when it was time to pull the plug, because it was most likely going to have to be that sort of thing.
When I left for my holiday, I had hoped, but I was not convinced that, or confident that I would see her on my return. So it was sad saying goodbye. I kept a cheerful face and sort of said, see you when I get back, confidently, but I wasn't confident that I would see her.
Talia had now been waiting for new lungs in intensive care at Mill Park Hospital for 4 months. Doctors were surprised she'd survived the ordeal.
In our setup, where the wait for lungs is very, very long, I don't think anyone could have expected her to survive 4 months in ICU, then get transplanted, and then survive the transplant. That's a big ask of anybody.
It was around about festive season, and very sadly, that is a time period where we often do find that our organ donation increases. And I remember saying to her around about festive season, Talia, it's going to happen, just hang in here.
Then, just as New Year approached, the transplant unit at Mill Park Hospital received details of a possible donor.
A call came in. It was like a Saturday afternoon, mid-morning, and I went to the referring hospital. I met with the attending doctor. We discussed the donor's condition and what has happened and the prognosis of the donor. Then I met with the donor family, his brother, and also a reverend. And then we discussed the option of organ donation, and they agreed.
I just returned from a family holiday when our recipient coordinator notified us that lungs had become available. And it was very clear from the very word go that it was a match for Talia with respect to her blood group, which was most important. And very importantly as well, they were more or less of the same size.
In the early hours of the morning, everyone had left me. It was dark in ICU. Everyone was asleep. I got this phone call from one of the coordinators to say, we're on our way back to the hospital with your lungs. I recall putting down the phone and just sitting for a second and thinking, this is really happening, and what do I do now? So I phoned my husband, and I couldn't get hold of him at the time. I phoned my mother, I think, and after that, everything is a blur.
Husband Jonathan had to go to Cape Town, 750 miles away, and was temporarily out of contact. But Talia was able to make calls to other family members.
Around midnight, she phoned me to tell me that they had found a great matching pair of lungs, and she was very excited. It was quite an emotional time. It came with a lot of tears, a lot of stress, and she was very, very excited, given the circumstances that she was in, to go through this operation.
Talia phoned me and said, Ma, they got lungs for me. And I was so excited because they were about to tube her, put a tube in her stomach because she actually couldn't even stand anymore. She was so bad.
We were fast asleep, and the phone rang, and I saw Talia's name come up on my screen. So it was Talia herself. And before she could say anything, I said, "They're here, hey." And she said, yes, they're here.
Jonathan eventually found on his phone Talia's attempts to contact him. He called her back.
Let me try phone Tal. Didn't expect an answer. I just thought maybe someone else picked up her phone. And she actually had answered the phone. And we chatted for quite a long time. And I remember I couldn't believe that she was so compass. She sounded, wouldn't say completely herself. She sounded very tired, very stressed. I could hear it in her voice, but she was able to talk to me.
Jonathan got the first flight home. While at Mill Park Hospital, the transplant team prepared for Talia's operation.
All we really needed to do was make sure that the donor lungs were healthy, which they were. So with great excitement, we then said, all systems go, and the process was started.
While Talia waited for her operation, her will was read. She agreed not to be resuscitated if anything went wrong, and she signed a form to donate her organs.
The early hours of the morning, we came in to see her, and she was terrified. You know, I wanted to take her off to theatre, and she said to me, I'm going to have a panic attack if you take me out of this little safety zone of her cubicle that she was here in ICU.
Talia was taken down to the operating theatre where she was prepared for surgery.
Talia had bronchiolitis obliterans and very difficult to oxygenate her. So the first thing that we do, in fact, in this kind of case, is to put them on an ECMO machine.
This machine acts as an artificial lung during the operation, pumping oxygen into Talia's blood.
And then once the patient is asleep and the patient is stable, the surgeon will now start operating and remove the diseased lung.
But there was a problem. Her new lungs were not quite as perfect as first thought.
One of the many issues with Talia's operation was that the donor was at a nearby state hospital where they didn't have facilities to ventilate him in a good setting. He was in the emergency department on a very old-fashioned ventilator, and the lungs were certainly not optimal.
The donor was brought to Mill Park Hospital and put on a new ventilator to improve the condition of the lungs.
The only decision was, were these lungs, which were really marginal, appropriate to be used for Talia? And they've certainly proven themselves to work well, but there was a lot of tension around that decision.
I think around about 5 o'clock, we went to theatre with the donor. At that stage, Talia was also being taken to theatre, and then the donor harvesting started. She was in the one theatre and the donor was in another theatre.
But the decision to go ahead with the surgery was still uncertain. The donor's heart was failing.
One of the consequences of the failing heart was that the donor went into pulmonary edema, which means the lungs fill up with fluid. That obviously makes them even less ideal for transplantation. So it was really a big question, should we proceed or not? Anyway, largely because of Talia's parlous state, we decided to continue. And in fact, the operation went ahead.
Meanwhile, Jonathan was rushing to the hospital to be at his wife's side.
Landed back in Joburg, and my dad picked me up from the airport and drove like an absolute bat out of hell, straight from the airport to the hospital. When I got there, she had been in for about an hour.
The rest of the family had assembled at the hospital hours earlier.
And they kept coming in and out of the theatre, telling us, like, updates.
Everything's going good and she's going under anaesthetic.
It was a bit of a struggle as they battled to get her lungs out because they were so decomposed.
The only scary news that came out, I remember Sussman coming out at one point, goes, well, her old lungs are out. They are black, black, black. He said that estimate of a week we gave you, we were wrong. She probably only had a day or two left. So he says, we didn't realize how bad they were.
I think we all just felt very numb. No one had any emotion. It was just, we were all exhausted, and I think we just wanted to kind of get to the other side.
It actually never went through my head that I was going to lose another sister. I never, ever once thought Talia was going to die. I just couldn't go there.
Then, after 5 hours of surgery, the family got the news they'd been waiting for.
I remember the surgeons coming out, and one by one, they just said, we think this is going to work. This is looking good.
She has now beautiful, baby, pink lungs.
What a way to start your day back at work. The first person I saw was Talia coming out of theatre after her bilateral lung transplant.
She came out of theatre on the 31st of December, final day of the year, great New Year present for her, a beautiful gift of life, and a whole new chapter effectively had begun.
The first thing I remember when I woke up, I remember feeling my face. I didn't hear all those noises that the oxygen makes, and I felt my face, and there was nothing blocking my face. I had nothing in my nose, nothing in my mouth, nothing in my face. I kept on touching, and it was amazing because I could breathe, and I wasn't anxious about it.
Her first thing that she said to me was, I can breathe. And that was just remarkable. And she did remarkably well after the initial surgery and the ICU stay. And, it almost was like a fairy tale.
Within a week, she was ready to go down to the ward, which is pretty much faster than most people anywhere in the world.
Less than 2 weeks after her lung transplant, Talia was discharged from hospital.
One of my colleagues came back from holidays on the 14th of January. And he came to me, so he said, I'm sorry. I said, okay. He said, your young girl's not in the ICU anymore. I said, no, she's not. He said, shame. I said, what are you saying shame for? He said, I thought you'd be unhappy that your young patient isn't in ICU anymore. So I said, how can I be unhappy? She's gone home. He just could not believe it. He said, I assumed that she wasn't there, she died. It was a remarkable journey that Talia had.
But a week later, Talia suffered a dramatic setback.
She came for her first appointment, very upbeat, very, very upbeat. And I was too, it was fantastic. She really looked well. And everything looked really good. Lung functions weren't as good as I'd hoped. And the chest x-ray didn't look bad. When I went to examine her chest, it really sounded awful. And I didn't know what it was at the time, but there was a big problem brewing.
I had this terribly high temperature. He doesn't know what's wrong with me, but he's checking me in. And by that evening, I had the most terrible fever. I was sick. I couldn't keep my head up. I was struggling to breathe. Everything all over again. So the trauma hit me badly this time because I was back on oxygen, didn't know what was going on.
It was clear that she had developed an acute rejection. And it was surprising because she was on such high doses of the medication that she should not have developed it. This is what we call antibody-mediated rejection.
Talia's family were horrified. She underwent emergency treatment called plasma exchange to replace her antibodies with those from a donor.
And she responded to that dramatically. I think she went home a week later. But it was also, once again, from critically ill to why am I still here? A week later. So a remarkable course, a really remarkable course there as well.
A year on from her surgery, Talia is close friends with Fawn and Alice, bonded by the new life they've each been given from donated lungs.
I've survived 2 transplants easily. Like, how lucky am I compared to those people who didn't even survive their first transplant and they never left hospital, so they never even had that opportunity to live normally, and they had all the same hopes that you did, and then it just didn't work out for them. So it really, you know, makes you appreciate things more.
Yeah, there's a thing that people refer to called survivor's guilt. So you feel bad that you've survived compared to someone else who didn't, and you know they also deserve the chance. So why you? So a lot of patients get that sort of survivor's guilt.
Every single day I live with a purpose. The simple cliche that every single day counts, every single day you should live it like your last. You really should take advantage and appreciate. I think about living almost every hour and every day. At least once in one hour do I think, wow, I'm lucky that I'm living. A year ago, I couldn't lift my head off the pillow. I literally couldn't get out of bed. And now I am living a completely normal life, my best life. I know the donor died, and I'm aware of what that family goes through and the trauma that family goes through by having lost their loved one. But I don't physically think of their lungs in my body. I think of the loss of them in order for me to survive and live a happy, healthy life.
I'm sore, hey? Her progress has been remarkable. I've recently seen her in the corridors in Sunninghill Hospital. I was amazed to see what a beautiful, vibrant young person she is.
To see Talia when she first came in, almost a year ago now, to what she is today, it's pretty awesome.
We shouldn't forget the family, and we shouldn't forget this wonderful, wonderful young human being who in fact sat there day in and day out with hope. And that's what everyone in this world deserves, is a little bit of hope so that you can move forward. And she never lost hope.
The most amazing thing about Talia is that she survived mentally. After 4 months in ICU, a long post-operative course, complications post-operatively, and then to still be functional emotionally and psychiatrically was what astounded all of us. So she's got huge mental fortitude, because physically she was a complete wreck.
3 years after she first fell ill, Talia and Jonathan have finally been able to rebuild their lives.
I felt like I had changed as a person being through all of this, and I was sure she had, and wondering if, you know, have I been through all this only to find out we're not compatible anymore.
I think it's fine down there because I think post-transplant, we can start readjusting again, and we can feel normal marriage all over again.
But it all worked out somehow, and definitely think we got one of the best marriages. We were far better people as a couple than we were before all of this.
Life happens, life changes, and what I've definitely realized is life can change within minutes for everyone. So I've learned to be grateful for what I have and all the blessings and wonderful things that I actually have to appreciate now.